Hello, and thank you for visiting Healthy Life. I hope you're all doing well. We'll talk about GERD, often known as acid reflux disease or heartburn, in this video. The contents of your stomach travel up into your esophagus, causing GERD. It's also known as acid. GERD, gastroesophageal reflux disease, is a condition in which food is regurgitated into the stomach. A valve is located at the stomach's entrance. The lower esophageal sphincter, or lay, is a ring of muscles that surrounds the lower esophageal sphincter. In most cases, when food flows through the lay, it shuts. If the lay does not completely close, or if acid created by your stomach can travel up into your esophagus if it opens too frequently. This can produce symptoms such as heartburn, which is a burning chest ache. If you have acid reflux, if you experience symptoms more than twice a week, you may have acid reflux disease, generally known as heartburn. GERD stands for gastroesophageal reflux disease, GERD. Let's have a look at the three types of acid reflux disease now that we have a better understanding of what it is. The following are the key variables that cause ARD. Food does not pass through the stomach quickly or at all. Too much acid in the stomach, delayed stomach emptying. Food clearance from the stomach might be slowed for a variety of causes, including eating large meals or lying down immediately following a meal. Being overweight or obese, consuming a large meal then lying down. Snacking close to night on your back or leaning over at the waist. All of these habits cause food to be retained in the stomach for prolonged periods of time. The acidic contents of your stomach are more likely to regurgitate into your esophagus. Gastroparesis, or delayed stomach emptying, is one of the most frequent conditions. Diabetes is one of the causes of delayed stomach emptying. It can also be brought on by a variety of factors. The uterus can push on the bowel and stomach during pregnancy, causing partial mechanical obstruction. Other factors include a lack of thyroid hormone, often known as hypothyroidism, and viral infections. Stomach infections, opioids, and some antidepressants, and it can also be caused by stomach infections. Parkinson's disease and multiple sclerosis are examples of disorders where this occurs. The third major cause of acid reflux disease is far more common than the first two. Excessive acid production in the stomach is number 2. Some of the most prevalent causes of excessive acid production in the stomach include eating particular foods, such as spicy or salty foods. Fatty foods, chocolate, garlic, onions, and citrus fruits are all examples of foods that are high in fat. Consumption of certain beverages, such as alcoholic beverages, carbonated beverages, coffee, or tea. One of the most common causes of acid hypersecretion in the stomach is smoking. Many medications, including pain relievers, might cause excessive acid secretion. NSAIDs such as ibuprofen, diclofenac, aceclofenac, and others. Aspirin, nifedipine, iron supplements, and bisphosphonates, blood pressure drugs. Takes for osteoporosis or low bone density. People who are under a lot of stress. Type A personalities have high levels of acidity in their stomachs. So there you have it, the three main causes of GERD. Poor acid or food clearance from the stomach, which can be caused by consuming large meals. Immediately after a meal or lying down early after a meal. Obesity is also a major factor in this. Gastroparesis, delayed gastric emptying, can be caused by diabetes, pregnancy, or other factors. Hypothyroidism, among other things. The final and most crucial aspect is a condition in which your stomach secretes too much acid as a result of consuming the wrong foods and drinks, excessive stress, smoking, and some medications. Aside from this, various structural flaws can also cause acid reflux illness, and one of them is the most prevalent of them is hiatal hernia. The diaphragm is a muscle that separates your lungs from your stomach. From your chest to your stomach normally, the diaphragm has a hole or hiatus through which air passes. The esophagus goes through this and links to the stomach. If this hole, also known as a hiatus, grows larger, the upper half of your stomach might move partially through your abdomen and into your chest. Acid reflux is aggravated. The stomach can move easily if the diaphragm muscles are weak. Congenital hiatal hernias are caused by inherited structural defects in the diaphragm. A hernia that appears at birth. Excessive abdominal pressure is one of the other causes. Muscular strain can occur as a result of heavy coughing, constipation, or strenuous physical activity. Pregnancy and childbirth. Obesity and hiatal hernia are both risk factors. So, now that we've covered some of the reasons of acid reflux disease, let's look at some of the symptoms. The signs and symptoms that this illness can cause. Heartburn, a searing ache, is one of the most prevalent symptoms of acid reflux disease, or pain that travels from your stomach to your abdomen, chest, or even up into your neck. Your pharynx. You may also have a lot of regurgitations. Food or liquids are put into the mouth, leaving a sour sensation on the tongue. If you have acid reflux for an extended period of time, you may have difficulty swallowing. Meal and a lump in your throat, as well as a persistent dull pain in your stomach or chest. Shortness of breath or other symptoms can also be present. Acid reflux can cause erosions in your stomach or esophagus, which can cause bleeding. Over time, blood is passed in your stools, which are blackish in color. Vomiting blood can be dangerous. Could suggest esophageal or stomach bleeding, which frequently appears as new blood. Other symptoms include persistent hiccups, nausea, and weight loss for no apparent cause. Wheezing, a dry cough, hoarseness, or a chronic sore throat are all symptoms of asthma. Let's have a look at how acid reflux disease is diagnosed. If you suffer acid reflux symptoms twice a week or more, you should contact your doctor. If drugs do not provide long-term relief, heartburn, sour irritation, and other symptoms. Acid reflux symptoms include a burning sensation in the mouth, abdominal pain, and hoarseness of voice. The majority of instances of acid reflux are diagnosed solely on the basis of clinical symptoms. If your difficulties last for a long time or if you aren't getting any relief from them, it's time to see a doctor. In order to confirm the diagnosis, your doctor may undergo certain invasive tests. GERD, or gastroesophageal reflux disease. X-rays of your upper digestive tract are among them. System. After drinking a gritty liquid that coats and fills the inside of your mouth, X-rays are taken. The lining of your intestines. This liquid, which is usually barium-based, enables for visualization. Your esophagus, stomach, and upper intestine in silhouette. Upper GI endoscopy, a thin, flexible tube with a light and a camera is used in this test. A tube that is placed down your throat to inspect the inside of your esophagus, and stomach endoscopy. Can identify esophageal inflammation, hiatus hernia, strictures, and other problems. The endoscope can also be used to obtain a tissue sample for tests such as biopsy. H tests, for example. Pylori. Another test that might be performed to determine a diagnosis is the ambulatory acid pH probe test is used to diagnose GERD. A monitor is placed in your esophagus during this test. To determine how often your stomach acid regurgitates into your esophagus, the monitor is connected to a small computer worn around your waist. When you have esophageal manometry, the rhythm of muscular contractions in your esophagus is measured. You take a swallow. It also assesses the synchronization and force exerted by your esophageal muscles. So far, we've discussed what acid reflux illness is, how it manifests, and how it's diagnosed. Let's move on to the acid reflux disease treatment section. Despite the fact that there are a profusion of over-the-counter and prescription medicines accessible to address a variety of ailments, dietary and lifestyle changes should be tried first before considering medicinal treatment for acid reflux disease. Modifications to one's lifestyle. While nutrition does not cause GERD, it can exacerbate the condition. Could enhance acid reflux into your esophagus, resulting in heartburn. Certain foods put your health at risk. The less's ability to prevent reflux and are best avoided. This varies from individual to person. Dishes like spicy, fried, and greasy foods, onions, and garlic are commonly mentioned. The most troublesome foods include tomatoes, chocolates, and beverages such as tea, coffee, and alcohol. As a result, it's advisable to stay away from these meals entirely. Certain foods can significantly alleviate the symptoms of acid reflux disease. Curd and yogurt, ginger, oats, and green leafy vegetables like spinach are among these items. Fruits including watermelon, pineapple, and papaya, as well as celery. As a result, make an effort to include these foods in your diet. More frequently in your diet. I'll leave 2 fantastic and useful tips at the end of this video. Make sure to watch this video all the way to the end if you want to learn more about acid reflux home treatments. If you wish to learn more about the diet associated with ARD, click the I button above. About the greatest and worst foods to consume for acid reflux sufferers, also be sure to. If you want to be updated about our forthcoming events, be sure to subscribe and click the bell icon. In the future, there will be more health and exercise videos. There are a lot of lifestyle modifications now as well that you can do to help you avoid acid reflux and lessen it. If you're going to bed hungry, don't eat anything. Before lying down, eat a meal at least 2 to 3 hours before. This will allow food to digest and pass through your stomach. Don't eat too much. At mealtimes, eat lesser portions or try to eat 4 to 5 small meals instead. Of 3 major ones, place a pillow at the head of your bed to raise it. Place wood or cement blocks beneath the feet of your bed to raise the head end by 6 to 8 inches. 9 inches tall. This prevents acid from simply refluxing into the esophagus when you're eating. Are resting. Maintain a healthy body mass index, BMI. Excess weight in particular. Obesity in the abdomen can exert pressure on your stomach, pushing it up and out, resulting in acid reflux. Avoid wearing apparel that is too tight. Clothes in which, when your waistband is too tight, it puts pressure on your abdomen and lower esophageal sphincter. Quit smoking. Smoking impairs the function of the lower esophageal sphincter. It also causes an excessive acid secretion in your stomach if you don't eat correctly. So, these are some lifestyle and dietary changes you may do to help prevent and treat cancer. Reduce the signs and symptoms of acid reflux disease. Let's have a look at the medical treatment now. Before we begin, it is my responsibility to notify you that I am unable to provide medication for acid reflux disease. All of these prescriptions are on a YouTube video, and the film's sole purpose is to educate all of you. Many of these medications are over-the-counter, OTC, which means they don't require a prescription. However, if you are experiencing these symptoms, you should consult your doctor for an extended period of time. So, with that said, let's have a look at the various options. Acid reflux disease is treated with a variety of medications. Antacids, which are the most commonly used medications for ARD, are number 1. As the name implies, these are antacids, which means they have basic compounds in them that neutralize the acid in the environment, so that there is no acid reflux in your stomach. The issue with antacids is that they aren't always effective. Their actions are only temporary. They are readily expelled from an empty stomach. The acid reaccumulates in less than an hour. As a result, the ideal approach to take antacids is around an hour after meals, just when the symptoms of reflux start to appear. Following a meal, an antacid helps to speed up the emptying of the stomach because food slows it down. When taken after a meal, it lasts longer in the stomach and is more effective. Antacids are a type of antacid, usually made of aluminum, magnesium, or calcium. Antacids that contain aluminum have a tendency to cause stomach ulcers. Constipation is caused by magnesium-containing antacids, whereas diarrhea is caused by magnesium-containing antacids. Antacids, those that have both aluminum and magnesium, have less issues. I've included links to all of them. Please see the list of drugs below for more information. Following antacids, the next class of drugs used to treat acid reflux disease is known as well as the H2 blockers. H2 receptors can be found in the cells of the stomach wall. Acid is secreted when these receptors are activated by histamine. As a result, medications were used to inhibit these receptors. A drug was produced. Cimetidine, ranitidine, and nizatidine are some of them, as well as famotidine. All 4 are available without a prescription, OTC. Without requiring a prescription, the OTC dosages, on the other hand, are lower than those accessible with a prescription because histamine is so critical for H2 antagonists should be given 30 minutes before a meal to prevent the stimulation of acid after a meal. This is done to ensure that the H2 blockers are at their highest levels in the body. When the stomach is actively generating acid after a meal, H2 blockers are also available before going to bed to prevent acid generation during the night. Proton pump inhibitors were the third type of drug developed specifically for acid-related diseases. PPIs, or proton pump inhibitors, such as omeprazole. A PPI also prevents acid from being secreted into the body. The gastrointestinal tract. The advantage of a PPI over an H2 blocker is that the PPI shuts off acid total production, and for a longer amount of time. The PPI is useful for treating a variety of conditions. It not only relieves heartburn symptoms, but it also protects the esophagus from acid. Hope the irritation in the esophagus will go away. When H2 blockers don't work, PPIs are utilized. If you don't treat your GERD symptoms properly, you can end up with consequences. Other than omeprazole, lansoprazole, and esomeprazole. Other PPIs that can be used for therapy include rabeprazole, pantoprazole, and esomeprazole. GERD, or gastroesophageal reflux disease. PPIs should be taken at least an hour before meals. The reason for this is that PPIs operate best when the stomach is working the hardest. After a meal, the body produces acid. If the PPI is taken before a meal, it is more effective. After a meal, when the acid is being produced, the levels in the body are at their highest. Pro-Motility Medicines are the next class of pharmaceuticals used to treat acid reflux illness. The muscles of the gastrointestinal tract, including the esophagus and stomach, are stimulated. For GERD, metoclopramide, a pro-motility medication, has been approved. Medicines that increase motility are known as pro-motility drugs. The pressure in the lower esophageal sphincter is increased, and the esophageal contractions are strengthened. Both effects are believed to minimize acid reflux. However, these sphincter effects are temporary. The stomach and esophagus are both small. As a result, the principal impact of metoclopramide is thought to be: it's possible that it's to speed up stomach emptying, which would lessen reflux. Pro-motility medications work best when taken 30 minutes before meals and then again at bedtime. Bedtime. Foam barriers are another type of medication that is used to treat acid reflux. Foam. GERD can be treated in a unique way with obstacles. Tablets or liquids are used as foam barriers, consisting of an antacid and a foaming agent. As the tablet degrades and reaches its end, it decomposes in the stomach, forming foam that floats on top of the liquid contents. The foam acts as a physical barrier to liquid reflux. Simultaneously, the antacid was bonded. Acid that comes into contact with the foam is neutralized. The tablets are the most effective. Taken after meals, when the stomach is enlarged, and when lying down, when reflux is present, is more likely to take place. There is only one foam barrier, which is made out of aluminum and other materials: alginate, magnesium trisilicate, and hydroxide gel. The medications listed above are usually successful in addressing the symptoms and consequences. GERD, or gastroesophageal reflux disease. However, this is not always the case. The quantity or number of medications used can vary. That are necessary for satisfactory treatment are so high that pharmacological treatment is unjustifiable. In such cases, surgery may be necessary to effectively stop acid reflux. Fundoplication is the precise term for the surgical treatment used to avoid reflux. Anti-reflux surgery is sometimes known as anti-reflux surgery. The part of the body that is being operated on is called the fundoplication. The fundus of the stomach is the part of the stomach nearest to the esophagus's entrance. The stomach is gathered, coiled, and sutured around the esophagus's lower end. The sphincter of the lower esophagus, the act of collecting and suturing one tissue to another, is known as suturing. Plication. This operation raises the pressure in the lower esophagus, causing it to narrow. Acid reflux is lessened. This is also true if the patient has a hiatal hernia. Can also be repaired at the same surgery. Fundoplication can be done in a variety of ways. A big incision known as a laparotomy with the use of a laparoscope, which only takes a few minutes. In the abdomen, there are a few minor punctures. The advantage of the laparoscopic approach is that it allows for a faster recovery time, as well as less postoperative discomfort. So, this was all about lifestyle changes. Acid reflux disease can be treated medically or surgically. Finally, I'd want to share something with you. 2 highly efficient home cures for acid reflux disease are presented to you. No. 1. Drink 2 glasses of warm water first thing in the morning. Before you eat anything in the morning. This is an excellent suggestion, which I have used. Acid reflux affects both myself and a lot of other patients. The rationale for drinking: when you drink warm water first thing in the morning, your stomach is fully empty. Empty and warm water cleanses the stomach walls and improves blood flow. It contains it. This increased blood flow brings vital growth factors into the body, which are already healing existing stomach erosions or small ulcers, as well as making the stomach walls and healthy esophagus aids in acid production regulation. This tip should be used on a daily basis. Within 10 days, you will notice an improvement in your problems. No. 2. Consume a lot of curd. Curd is a superfood that can help with a variety of ailments. People who have acid reflux disease. Curd is a milk-derived dairy product. Milk has a significant amount of calcium that prevents buildup of acid by removing the excess. As a result, it's an effective acid reflux home treatment. So that was all about acid reflux disease and how to treat it. I'll be doing more videos in the near future. I'm going to talk about the best acid reflux diet and other natural therapies. So be sure to subscribe and click the bell button to receive notifications. I hope you enjoyed watching the video. By clicking the join button, you can help healthy life. Thank you very much for taking the time to watch.